Hello? Okay. Hey! All right. Hello, everyone. Thank you so much for spending your lunchtime with us. My name is Allison Hanson, and I met some of y'all the other day, but I am the Tampa General Emergency Medicine Ultrasound Program Director. And for lunch here, we have a special treat. We have a couple residents that are here to present some interesting cases. So first up is Dr. Devon Khiabani, and she is a PGY1 at Tampa General, which is a local level 1 trauma center. Some of you may know. Some interesting facts about her. So she went to, she's from Tampa, and she went to the Alabama College of Osteopathic Medicine. And she used to train Brazilian Jiu-Jitsu, which I definitely believe. Um, so she actually couples matched at our EM residency with her husband, obviously, and they are quite the power couple, and like literally power. They have their home gym, and they're always posting workout videos and all that stuff. So I will say he's got they're a great uh, I guess, match for each other. He's got the arms, the upper body, but she's got the calves.
That's right. Don't
That's
let him forget
right.
it.
Okay, so without further ado, Devin, go ahead and take it away.
All right. Good to meet you all. Can you hear me? I'm not sure if this is on. Yeah. Okay. It's good to meet you all. Thank you for being here. I'll go ahead and open this up. All right. So today we'll be going over some kidney pathology ultrasound evaluation. So lots of common, things that we treat every day, and we'll go over some high yield pathology and diagnosing on ultrasound. So we'll just kick it off with the basics and our probe selection, probe placement, and patient placement. So typically we use the curved linear probe, which is pictured here in this picture. And you can also use the phased array, which is sometimes called the cardiac probe. That can be good for getting kind of in between the ribs. But typically we use the curved linear. And always important is our probe indicator direction. Typically we have that facing the patient's head, which is kind of the arrow you see here. And so in this position, you'll be getting, and we'll go in a little bit more into this, but you'll be getting the longitudinal view of the kidney. And we'll go into all this, but you're going to want to get two views of the kidney, both longitudinal and transverse. And to do that, you'll be rotating your probe. So here's a picture here. We also have a video. And so on the right-hand side, to rotate the probe, when you're on the right-hand side of the body, you'll be rotating that probe counterclockwise, and so that indicator will be going towards the bed. Whereas on the patient's left-hand side, you'll be rotating it towards the belly button in order to get your transverse picture. And kind of the anatomic location you're looking at is in that mid-axillary line, although each patient body is going to be different. You're going to have to slide a little more posteriorly for some, you're going to be scan until you see it, but typically that's your guideline. You're in that kind of mid-axillary area. And obviously the preset that you'll be selecting on the ultrasound machine will be the abdominal preset, or you may have a renal preset on yours. So here's just kind of like a little video of just what we mean by rotating the probe, just the arrow moving towards the bed here. Just like that. I like this picture just because it's kind of like if you were just looking at the body and you could see through and you see what your probe is on. You can see kind of right here, you're in that mid-axillary area, and you're right on the beans. So we'll get into a little bit of the anatomy here. So this is what you'll be looking at in that view. And once you see it, you can't unsee it. To me, apparently this is controversial, but the kidney to me looks like a croissant. I believe you were eating one just a little bit earlier. I saw that. I can't unsee it. It looks like a croissant to me. So here in the blue highlighted area is your renal pelvis. And then you have your renal cortex with the pyramids and your calyces, your major and minor calyces. So you can kind of just look left and right. Here's a video scanning through that kidney in that same view, just so you know what you're looking at. The pelvis, the cortex, the pyramids in here, and the calyces. And again, this is your longitudinal view and what that looks like. Okay, here is a video of that right kidney in transverse. So the video will show you scanning through the kidney in transverse. It's just important to always get your two views. And transverse is also called short axis. So you might see it written either way. So that's kind of our little just basic review of looking at the kidney on ultrasound. So now we'll get into a little bit of just some high yield pathology that you'll see like very commonly. We've got your hydronephrosis, nephrolithiasis, and renal cysts. And we'll go into differentiating simple and complex and why that can be important. So to kick it off, we'll start with hydronephrosis. So as we know, this is kind of an abnormal enlargement, distension of the kidney, most likely due to some type of obstruction downstream, and then we have urine backing up into the kidney. So fluid appears like this dark anechoic area on ultrasound, and this is a video that'll play through here. So what you'll be looking at is this dark anechoic area beginning in that renal pelvis. And then here on the right-hand side is a nice little picture where they have it kind of labeled out again, just a still frame, where you'll be looking at the renal pelvis here and the calyces. This is a grading system that grades hydronephrosis on ultrasound, but I don't want you guys to get like too lost in the weeds of it. What we're really looking for is mild, moderate, and severe. And the way to think about it is anatomically, typically you have some type of ureteral stone or obstruction, and the fluid is backing up into the kidney. So the structures that are closest to the obstruction will be dilating first and experiencing that pressure. So that's kind of how you think about that staging. You're starting at the pelvis, pelviectasis, pelvis dilation, moving into the calyces, and then the pressure, transmits into the cortex. So you really just think about it going anatomically, pelvis, calyces, and then into the cortex. But what's most important is just really differentiating between mild and severe. And we'll look at some examples, and I think you can see here a pretty good differentiating between mild and severe. Why this is important, this could change your management. Typically a mild obstruction, there is some data that shows, if there's a ureteral stone causing a mild hydronephrosis, it has a very high likelihood of passing. It's probably under that 5 millimeters. So, this is something that if you're speaking to urology about a patient, or, you're trying to differentiate your management of the patient presenting, it's just something to keep in mind. So here's a picture of hydronephrosis or mimic. This gets a little bit into kind of a pro tip area. It's obviously important to recognize it's hydronephrosis potentially, but then the question can be, you also have a lot of vasculature in this renal pelvis area. And as we know, blood vessels, fluid, they're going to appear very similarly, dark and anechoic. So differentiating between hydronephrosis versus renal vasculature is also important as well. So what you can do, you have this, and this is kind of a topic for, it could be a whole another lecture, but using the color Doppler modality on your ultrasound, you have it in frame, you throw the color Doppler on, and if it's hydronephrosis, it will not light up. However, as you can see here, what looked initially to be hydronephrosis is actually renal vasculature, which you can differentiate once you throw that color Doppler on. So just another tool for your toolbox. Okay, so a quick little case here just to kind of lock it in. You have a 35-year-old female, history of ureteral stones, presents with flank pain, bedside ultrasound reveals. Anyone want to take a gamble? What they'd say just initially this is? What does it look like? Hydronephrosis, yeah. Probably trending towards like the mild to moderate. So good. And just super quick to pick up on. So moving into the next pathology, we have nephrolithiasis here. The good thing about stones in the body on ultrasound, they look pretty similar, whether you're looking at the gallbladder or looking at the kidney. What you're looking at is this bright white hyperechoic structure typically that has dark shadowing underneath it. So again, I like this I like it to be colored out for me and outlined here. So comparing left and right here, you can see that bright white hyperechoic structure and some shadowing coming down. And then they outline it and color it nice for us here, just so you can really see what you're looking for. Your stone and the acoustic shadowing. Here's another example of some stones and dark shadowing coming down. And a live example here. Can anyone pick up on what we're seeing? Now that you know what you're looking for. Yep. Yeah, that's like the first thing you see, right? You see that shadowing coming down, and then you follow it back up, and there's a nice stone there for you. And here's another kind of trick of the trade here. Throwing on that color Doppler modality again. Let's say you see shadowing, you're not sure if you see the stone. It's another great way that you can pick it up. Let's see if the video plays here. So this is called twinkle artifact. And this is something you can see with the stones. It's a focal area of color flow. It falsely depicts movement when there is none. There's a couple of theories out there as to what actually causes this effect. It's a little above my pay grade, but to my understanding, it could be due to the roughness of the stone. It could be due to time transmittance delays from what I was reading. So that being said, you can look for that twinkle artifact, throwing that color Doppler on, and find that stone. So another video here. We have a 58-year-old female with flank pain. Bedside POCUS reveals. Anybody see anything interesting? Looking at this area here. Sorry, I thought I put this on a loop. I apologize. But yep, so looking right in this area, see that bright white structure come through with shadowing below. All right. And then last topic, renal cysts. This is something you will commonly see as well. I think there's some data that suggests, I think it's 50% of people over 50 have a renal cyst of some sort. So it's something you will commonly see. And starting with simple versus complex. So simple over here on the left-hand side of the screen, it's a thin-walled, fluid-filled structure. And it looks just like this. And you're typically looking, it's in the cortex, whereas hydronephrosis, again, we're like looking for it to be in the pelvis, pushing out into the calyces. Cysts will be in the cortex, typically. And differentiating between complex, the complex cyst will have a margin of septation. As you can see here, how the cyst is divided into these two areas by this wall. So that is a differentiator between. And why that's important, although most renal tumors are solid, there are some renal tumors that can present with this complex cyst structure. So again, just thinking about management, it's just something to keep in mind if you were to find a complex cyst on a patient, that there is that potential. It's just something else that to be aware of. All right, so that was most of the presentation. We're just going to do a quick little summary and just recap what we've gone over. So can anyone tell me what blank are seen on ultrasound as a bright hyperechoic structure with dark shadowing coming down from it? That's right. And what can be used to differentiate between hydronephrosis and vasculature? Boom, color Doppler. And if a patient presents with flank pain, I should consider performing a, yes, always. So a renal cyst appears as a thin-walled, fluid-containing structure in the renal, yes, or the parenchyma. And in order to obtain a transverse view of the right kidney, I rotate my probe indicator down, yep, to the bed. I like to the bed, and on the left-hand side, in order to obtain a transverse view of the left kidney, I rotate my probe indicator up. Yeah, I like to the belly button and to the bed is how I can remember it. So that is my presentation. Did you guys have any questions or want me to rewind to anything? I appreciate y'all being here. Yeah, just some good quick hitting take home renal ultrasound. Thank you guys.